First of all, welcome and thank you all for coming to our presentation today. We are Lieke, Sacha, Loïs and I'm Nienke, and we are currently studying communications at Avans in the Netherlands. And today we are here to tell you something about the coronavirus. You've probably heard of it since it was kind of a big deal around the world. And so that's why we're going to focus on how it affected us right here. So we're going to talk about the origin of the virus. Then about the symptoms, and after that we're going to talk about all the kind of vaccinations we had to take, and in between a little bit of advice. And at the end we're going to take a look into the future. So as you probably have heard, the coronavirus has found its origin at an animal market in the Chinese city Wuhan. In December of 2019, where Dr. Lee reported the first outbreak, but it wasn't until February 2020 when we had our first case right here in the Netherlands. At the end of the month, we had a very popular tradition called Carnival, where thousands of people came together in close contact and became infected with the virus. And that's when we started to notice the real effects of the coronavirus here in the Netherlands. And now Loïs is going to talk to you about the symptoms of the virus.
The symptoms of COVID. They may appear 5 to 6 days after exposure. Do you know what signs to look out for? Let me tell you about it. The most common symptoms can include fever, coughing, and tiredness. Also, losing your taste or smell is a common sign. Some people are more likely to get really sick. For example, people that's older than 70 years. The higher your age, the more likely you are to get really sick. Older people are also more likely to have Alzheimer's disease. Alzheimer's can make it more difficult for them to remember the precautions recommended to prevent infection. Also, people who are unvaccinated are more likely to get very sick. Your health really affects the symptoms you will experience. If you already have lung problems, you're more likely to develop severe signs. Some medications for lung problems can weaken your immune system. Also, heart failure and diabetes can be a cause of severe symptoms. Also, men are more likely to get really sick than women. There are a few emergency signs. If you have any, seek care immediately. These signs are pale or gray skin, trouble breathing, chest pain, and the inability to stay awake. If you recognize any signs, stay at home and do a self-test. If the test is positive, you should self-isolate immediately. Of course, it's better to prevent the spread of COVID. This advice will help you preventing the spread. Wash your hands often. Cough and sneeze into your elbow. Don't shake hands. Wear a face mask in crowded places. Cover your mouth and nose with your elbow or a tissue when you cough or sneeze. And throw away the used tissue. And then wash your hands right away. Avoid touching your eyes, nose and mouth. And avoid sharing dishes, glasses, towels, bedding and other household items if you're sick. Then I wanted to talk about the medicines. There are 2 types of treatments. At first, antiviral treatments. This treatment targets specific parts of the virus to stop it from multiplying in the body, helping to prevent severe illness and death. And the second one, monoclonal antibodies. This helps the immune system recognize and respond more effectively to the virus. Some treatments might have side effects or interact with other medications you are taking. I advise to ask a healthcare provider if medications to treat COVID-19 are right for you.
The vaccinations. In the Netherlands, the vaccination against the coronavirus started on January 6, 2021. The main reason why we started vaccinations was because of the overload of sick people in the hospital. Because of that, a lot of surgeries couldn't be performed for the normal sick people. The hospital was too busy with treating people with corona. In the Netherlands, we have 3 sorts of vaccinations. One is Moderna, 2 is Pfizer, and the third one is Johnson & Johnson, and in the Netherlands we call it Janssen. At first, if you get the Johnson & Johnson vaccination, you're very lucky, because you would only get 1 shot. The other ones require 2 shots between a time slot of 6 weeks. But a couple months later we were informed that the Johnson & Johnson vaccination was not as effective as it should be. So the people who were getting one shot of Johnson & Johnson had to get another shot to make the vaccination more effective. Then we have also the side effects of the vaccination. Side effects such as fever, headache, tidiness occur after a vaccination with COVID-19. In a significant proportion of those who were vaccinated. Side effects such as muscle pain, joint pain, chills, nausea and vomiting may also occur after getting vaccinated for COVID-19. These symptoms will start within a day or so and usually go away by themselves, but it's not a pleasant thing. The number of people who experience these side effects after vaccination differs depending on which vaccination they received. Women and young people are likely to get more side effects after the vaccination. Then I'm going to talk about yes or no taking the vaccination. A part of the citizens of the Netherlands were excited to get the vaccination, but a lot of people decided they didn't want the vaccination. There were different reasons for it. A group felt that the government was chipping them because they believed in the complot theories. Another group was afraid of needles, and some people didn't want the vaccination because they felt obligated by the government to take the vaccination. If you did decide to take the vaccination, it was going to be in your favor. Then later on, we get the booster. So in January 2022, there's also an opportunity to get the booster vaccination for the first time. The booster vaccination is a repeat vaccination, so that ensures that you will remain protected against corona to prevent it from serious illness, hospital admission, the reason why we started the vaccinations. So the booster vaccination can be obtained from 3 months after the last shot or 3 months after you get a corona infection. Now more and more people are getting a booster for the winter. So the big question is how effective is a vaccination? If you're vaccinated, you can still get infected with the coronavirus. The vaccination protects against getting really sick from the virus, but several studies have been published that show that vaccination also reduces the transmission of the virus from another person to another. Research by the RIVM shows that vaccination significantly reduces the transmission of the Omicron variant of the coronavirus. A booster vaccination provides 63% against transmission of corona to the housemates. This means if someone in your house becomes infected with the coronavirus, after booster vaccination, they have more than 2 times lower of a chance to pass the coronavirus on to their housemates than someone with corona was not vaccinated. So I would say it is very effective. What is your opinion about vaccination, and do you think it's effective? Right now we're going to talk about the future, and Lieke is going to tell us something about it.
Yes, now we're going to talk about the future. Although the biggest COVID wave is past us, we still live with the virus among us. The future will never look the same again after the virus. In most of the countries, the measures are most of the part gone, but it doesn't mean that everything is the same again. There are positive and negative changes in the world because of COVID. A few positive are such as when we get sick before COVID, we tend to go to work after all. But since COVID came along into our lives, we are more careful. If we're now sick, we stay quicker home and we work from home, or we do it via Teams or something. Because we don't want to risk getting other people sick, so we're more careful. The future brings us also more appreciation for human contact and being able to go to school with a full class and not online. There are also a lot of negative changes through the virus. A lot of people lost friends and family close to them because they're getting sick and they died. The mental health with young people has since COVID began dropped super quickly. The wait lists are bigger than they ever were before the COVID virus. Before they get help, so that's a big problem. The aftermath of COVID cost a lot of people their jobs. The job industry has a big change since COVID. For instance, the catering sector had shortage of waiters because a lot of students went from the catering sector to working for the GGD. In the future, more and more people are going to work from home. Because of the virus, people had to work from home. In this time, it's not obligated anymore, but a lot of people keep on working from home because it's easier for them and they're now used to it. This was our presentation. We hope you enjoyed it and you have learned a lot more about COVID. And if you have questions, you can always ask us in Teams or mail.